Hey everyone, it's Peter with Physical Therapy TV, and in today's episode, we're going to discuss lower back pain, specifically connecting your low back pain to your iliopsoas muscle. What is the iliopsoas? Well, the iliopsoas is one of the core muscles responsible for bending your body forward as well as lifting your knee up to the ceiling. Basically the motion called flexion. It's a very deep muscle located in your abdomen, and its origin is from the vertebral column as well as the inside of your ilium, or basically your pelvic bone. And those two muscles together, the psoas and the ilium muscle, join together to insert into the upper thigh on the inside of the femur. Um, when this muscle gets tight, it can cause immense pain either in your groin, can cause your pelvis to get distorted and rotated, which can lead to sciatica. It can even lead to bulging and herniated discs and a multitude of different spine pathologies. Now, where is this muscle located? If you were to go 1 inch from your belly button to the side and then drop 1 inch down, if you were to take your hand and you were to poke into that area, that is basically where you can palpate or feel the iliopsoas muscle. When it's very tight, doing this would be very painful and very tender, and it's a good indication of that muscle becoming very tight, weak, and inflexible. When you sit a lot especially, you are going to reduce the range of motion of the iliopsoas muscle, and it can cause this muscle to become very tight and lead to back pain. Okay, so I wanted to share with you some quick facts about the iliopsoas. It's the strongest of your hip flexors. The iliopsoas is important for standing, walking, and running. It is a typical posture muscle which is dominated by slow twitch red type 1 fibers, and it's therefore very susceptible to pathological shortening or contracture, like I alluded to before in the previous slide. So sitting a lot, driving a lot will cause that muscle to become very short and very tight, and is bound to give you some form of back pain. Again, it's coupled to people with sedentary lifestyles, and it requires regular stretching to maintain normal tone. When the shortening occurs, it can lead to an increased anterior pelvic tilt and lumbar lordosis and limitation of hip extension. Now, there's a test you can perform to determine if you are starting to have some issues with your iliopsoas, and that's called a Thomas test. We use this in a clinic a lot to assess the hip flexors flexibility of a patient, and also specifically to see if there's shortening of the iliopsoas occurring. What you can do is you can lay on the side of a bed, preferably a treatment table or a hard surface, and what you want to do is you want your feet to be dangling, so it's important that you're not able to touch the floor of your feet. What you do is you start with both knees bent up to your chest, and then what you can do is lower the one leg down towards the floor very slowly, while keeping the pressure on the other knee pulled up towards your chest. You can see this arrow is indicating that the direction of the arm pull, pulling the knee up to basically to your chest area. The other leg just slowly gets lowered, and you just totally relax the other leg. You can see this red line right here, which indicates horizontal or being in line with the surface that you're laying on. If your leg is unable to drop below that line, in other words, drop below 180 degrees, it is definitely an indication of tight hip flexor muscles, and that's indicating to us that you are having some tightening issues. You can compare both sides. If one side is more predominant, that's a good indication of where your focus needs to be to assess this. We can't see it in this picture, but you can also see that if your leg cannot go beyond that line, and if it's even flopped out to the side, that can indicate some tightness in your ITB as well as your hip external rotator muscles that are becoming tight and indicating weaker hip internal rotator muscles. Again, when you test positive with the Thomas test, it's a good indication that you are having hip flexor issues, and it can lead to spine pathologies such as degenerative disc disease, herniated discs, sciatica. It can cause uneven leg length, and that in turn can lead to knee pain, plantar fasciitis, a multitude of different problems, as well as back spasms. I hope you found this video helpful. I'm going to put together a free PDF report for you that's attached to this page that will include some passive and active stretches that you can use to address this if you're having issues in this area.